Autism is defined by a certain set of behaviors and is a spectrum disorder that affects individuals differently in varying degrees. We spoke with Dr. Barry Grossman and Dr. Ruth Aspy, authors who both specialize in assessment and intervention for individuals with autism spectrum disorder. We asked Dr. Grossman to tell us the name of their book and why they wrote it.
The name of the book is The Ziggurat Model. It was written by Dr. Aspy and myself. We wrote it because Dr. Aspy and I were working in the schools, and we saw this great need for improved programming for students on the spectrum. And so we really set out to do, when we developed this model, was to give people the tools that they need, really a roadmap, to design a comprehensive program for individuals on the spectrum. And the Ziggurat, it's a funny sounding name, but really what it is, it's like a pyramid, but it's a terraced pyramid, the sides like a little stair step, and each terrace, each level represents an area of intervention that must be included in order to be comprehensive. And so that the Ziggurat itself is a very strong visual reference of what a program needs to incorporate in order to be comprehensive. You've got to address the underlying autism, and you need to do so comprehensively. Otherwise, the programs tend to fall apart and nobody benefits.
The two main principles under the Ziggurat model are make sure that you are able to see the underlying autism, and the second is make sure that you address the range of needs. Don't just address the social differences. Don't just address the give them visual supports, but make sure that you address sensory challenges, you provide good reinforcement, you provide structure, make sure that you, we call it task demands, make sure that you give them the modifications that they need, and make sure that you teach skills that are going to make a difference in their future. One of the reasons that people who have autism aren't reaching their full potential is they're not being identified, and certainly they're not being identified early enough. It's possible to identify people with autism by the age of 2 or 3, but people with high-functioning autism are often not identified until the age of 11, and girls with autism, sometimes not at all. We meet people in our practice who are 17, 18, sometimes 40, who have lived all their lives with autism, and no one has identified it.
How important is it for autism to be diagnosed early in a child's life?
The American Academy of Pediatrics has made it very clear. It's been, over the past several years, an emphasis for pediatricians to, in every well child visit, to check for some red flags. It's critical at very early on in the first 2-3 years of life for people who are working with children to be aware of what those red flags are. There's tons of research that shows us that the earlier intervention that's put in place, then the better the prognosis, the better the long-term outcome. Every student who has autism, without exception, needs at least 1 hour a day, 1 class period a day, focused on problem solving, social functioning, communication. What works best for students who have autism spectrum disorders is a program that's individually designed, that really understands what does autism look like in this student, how is it expressed for this student. And the first thought shouldn't be, so let's put them in some other class and meet their needs in some separate program. The student belongs to everybody. The student doesn't just belong to special education. The person in the cafeteria needs to know how to address a student with autism, how to meet their needs. The school administrator needs to know what are the needs of kids with autism and what supports do staff members need who are working with these kids with autism, and what are the differences we're likely to expect.
We asked Dr. Barry Grossman, what are some key points to good education planning for individuals with ASD?
The first key is really being able to view the student through the lens of autism spectrum disorder, understand what those needs are, and what we want to do is to match the interventions, of course, to address those needs, but we need to ensure that our program is comprehensive. So that's the first key, is really understanding the underlying autism. The second key is making sure that your program is comprehensive enough. It's a thoughtful approach to design a program. We don't just throw a program together, and it's a very complex disorder, and so we have to ensure that we develop a program that's comprehensive enough to address these very complex needs. And last, of course, is implementation. So you may have this great program, but we need to make sure that the people who are implementing it understand the needs and the strengths of the individual, and they build on those, and that they successfully implement that program.
What type of school program works well for children with ASD and their underlying needs?
It really involves a systems change here, because what we see is there can be an overemphasis on things like reading, writing, and math. These are very important things for all people to know, but for someone on the spectrum, the skills that are going to help them to be more successful throughout life, we're talking about social skills and communication skills and so on, emotion regulation. These are key skills, and so we need to ensure that our programming is addressing the key underlying needs. So, for example, communication differences, social differences. Sometimes people focus on behaviors, but they fail to address what underlies those behaviors, the source of those behaviors, the fact that there may be some differences in how they understand and perceive their social world, the perspective taking, and for individuals on the spectrum, they may be very poor in understanding the social world and taking perspective, and they don't understand the things that we learn just through osmosis. We learn through being in this world. They have to be explicitly taught, and so their behaviors are a little off because we failed to address the disability. And so we have to ensure that the program we develop for someone on the spectrum actually addresses the symptoms associated and the differences associated with ASD. Education is key, but also making sure that we're really targeting the kinds of skills that are going to really make a difference in this person's life. It involves a team approach, and the team can be everyone who is involved in the life of this person on the spectrum. Because what we want to do is help them to develop the skills these are life skills they're going to need so they can be successful in the workplace, so they can live independently, they can develop and maintain relationships with others, have a peer group, maintain a home, these kinds of skills. So everyone's involved. And I hope in 5 years or 7 years that more employers are understanding the kinds of things that they need to do and the gifts that these individuals can offer them in their workplace setting is amazing. These are wonderful people who have wonderful skills to offer, but we have to make sure that we're making that environment conducive to and hospitable to them.